Hey, welcome back. Today we're wrapping up the Traffic Triage Map Series with the Green Zone, where you will learn to spot what's stable, routine, and safe to delegate. So if you're feeling unsure about delegation, prioritization, or what you can safely let go of, this is the video you need to watch until the end. And don't forget, I've got a free red, yellow, and green zone checklist for you, and the link is in the description below. As you are studying for the NCLEX, a few reminders. The NCLEX is testing safety, clinical judgment, and what to do first. By the end of this video, you will be able to 1. Define what counts as a green zone answer, 2. Spot what's safe to delegate as a UAP or LPN, 3. Tell the difference between stable versus unstable clients, and 4. Use green zone thinking to make faster, safer test choices. All right, let's do a quick review of what the traffic triage map is all about. So when we look at the traffic triage map, we learned in the prior videos that red equal act now, save a life. The yellow means watch closely or monitor as it could get worse. And we're going to be reviewing the green zone today, which means stable and or safe to delegate, but it does not require an immediate RN action. Always remember it is important to connect the color to what the question or the STEM is asking. If you haven't watched the previous videos of this series yet, please pause and go back because today we're building on those concepts. Knowing how to spot a green zone task only makes sense when you know what urgent looks like. The green zone is where the patient is stable. The task or situation is predictable, and there's no need for your RN judgment at the moment. For example, you have patients who might have a chronic condition with expected symptoms, or maybe it's just routine monitoring that's required. Maybe it's even just feeding a stable patient, or maybe it's even like a patient who is post-op day 3 that you need to assist with ambulation. Basically, if there's no surprises, it's probably a green zone situation. Also, the green zone answers or questions usually don't involve initial assessments. They don't require clinical judgment either, and they don't require any new teaching or evaluation. So always ask yourself, can this be safely done by someone else? Can this wait until after I take care of someone who is more critical? And if the answer is yes to either, this is a green zone task or situation. Some green zone clues to watch out for on the NCLEX are, for example, if they say, there's a chronic COPD with expected mild SOB, this is probably a green zone situation that's happening. If, say, for example, the patient is a stable diabetic, just needing a blood sugar check, or if the patient is post-op day 3 and they require ambulating with assistance, or if there's some sort of discharge teaching that is required or requested, or maybe there's oral medications that need to be administered for a stable patient, or even vital signs or feeding for a patient who is alert, oriented, and stable. If it's predictable and it's not life-threatening and doesn't require RN clinical judgment, it's a green zone. So before we move on to do a few sample questions, I wanted to briefly talk about delegation, which I'm thinking of doing a separate video. Comment down below delegation if you want me to do a separate video. The goal of delegation is a phrase that I created, and it's the caring provider delivers safely, or TCPDS, which stands for T for tasks, C for circumstances, P for person, D for direction, and S for supervision. Whenever we decide to delegate, we need to ensure that we are delegating the right task and ones that do not require or involve RN clinical judgment or critical thinking skills. We need to delegate to the right person to ensure that our client remains safe. We also need to ensure that we provide clear directions and confirm that the person you are delegating the task to understands. And then, as a delegator, we still are ultimately responsible for the task, so we also need to evaluate the outcome of the delegated task. So, just to break down examples of tasks that can be delegated based on the person's role. So, for example, an unregulated care provider or UCP, sometimes even called unlicensed assistive personnel or UAP, they can be assigned tasks that do not require an assessment. They can assist with skincare, range of motion, ambulation, grooming, and hygiene, turning, intake and output, oral care and feeding, etc., on stable patients. An LPN can be delegated the same tasks as the UCP or UAP, and depending on the facility's policy, they can gather data, they can take on stable clients, perform simple dressing changes, suctioning, urinary catheterization, some medication administration like oral meds, subcutaneous, intramuscular, or even selected piggyback medications. However, an LPN cannot initiate teaching and education. They can only reinforce it once it has been completed by the RN. They cannot complete assessments, planning, evaluation, or interpret data of unstable patients or clients. And then the RN can do everything that the UCP and the LPN can do. Plus, they also are able to manage both stable and unstable clients, which would include as well completing assessments, planning care, initiating teaching, and administering all medications, including IV medications. All right, let's look at a few questions that I have here for you. The first question is, which task can the nurse delegate to a UAP? Is it A, to reinforce teaching on insulin injection? Is it B, feed a stable post-stroke client? Is it C, administer oral medications to a confused patient? Or is it D, to monitor a post-op client for pain? So I know that this here is a green zone, besides the fact that that's what we're learning today. But I know it's a green zone question because it's speaking about delegating to a UAP. So, like I mentioned earlier, your answer choices should match what the question is asking. So, because I know that this is a green zone question, I'm going to be looking for a green zone answer choice. So, let's work from the bottom up, okay? So, monitor a post-op patient or client for pain. So this here, I automatically know that when it comes to pain and monitoring, this is going to be most likely an RN only task. So this is going to be a red zone answer choice. C, administer oral medications to a confused patient. So this is going to require RN clinical judgment in order to determine whether or not it's safe or not for the confused patient to receive oral medications. So this here is going to be a red zone answer choice. Feed a stable post-stroke client. So this patient is stable. This patient requires feeding. This is a green zone answer choice because I can actually delegate this to a UAP. Now, reinforce teaching on insulin injection. So because I'm looking for tasks that I can delegate to a UAP, A is actually going to be a red zone answer choice because this is something that I need to delegate to an LPN when it comes to reinforcing teaching. Okay? So here we have the correct answer is going to be B, which is feed a stable post-stroke client. All right, let's work on question 2. A home care nurse is assigned to visit a preschooler who has a diagnosis of scarlet fever and is on bed rest. What data obtained by the nurse would indicate that the child is coping with the illness and bed rest? Is it A, the child insists that their parents stay in the room? Is it B, the child sucks their thumb whenever they do not get what they asked for? C, the parent keeps providing new activities for the child to do? Or is it D, the child is coloring and drawing pictures in a notebook? So when I look at this question, I need to ask myself, what is this question really asking? So it's asking me to indicate what data would let me know that the child is coping with the illness and bed rest. Okay, so coping with it. So this here is an evaluation type of question. Okay. So this here I know is a green zone type of question. Okay. Because I'm looking for stability, I'm looking for routine behavior, I'm looking for positive adaptation, right? And it's not really about what's wrong or what to do next with this question. It's more so about behavior and does it actually reflect successful psychosocial adjustment? Okay, so let's look at our options here. Okay, so let's start with D. The child is coloring and drawing pictures in the notebook. So this is independent, right? And it's very or age appropriate, right? Play for a preschooler. And it also shows that the child has some creativity. They have the ability to express themselves emotionally, and they are engaged, right? And so this is a positive coping mechanism. And so because it's a positive coping mechanism with the situation, right? The child is ill and is on bed rest. I'm going to say that this is a green zone answer choice, okay? Because the child is stable, they're engaged, and they're emotionally regulated. C, where the parent keeps providing new activities for the child to do. This is about the parent's behavior, right? It's really not about the child's coping mechanism, even though it shows effort of the parent to stimulate the child, which is good, right? We do not know if the child is actually responding. So this is not the best evidence that the child is actually coping. So I would say that this is a yellow zone because I would need to monitor more or closely to see if the child is responding to the parent. Okay. Then we have B. Okay. So we have the child sucks their thumb whenever they do not get what they asked for. This actually shows regression under stress, which sometimes is normal for preschoolers. If this actually occurs quite often when the child's demand is not actually met, this shows emotional dysregulation. So it's not dangerous, but it's also not a healthy coping mechanism either. So for me, I would want to monitor this, and I would want to monitor it to see how it progresses and how frequent this is occurring. So I would give this a yellow zone and make it a yellow zone answer choice. Okay? Now, A, the child insists that their parents stay in the room. So this is demonstrating mild anxiety and attachment behaviors, right? Which is common in preschoolers, especially when they're sick. So at this moment, this shows dependency, and we also need to monitor this to see if it's something that is going to get worse or is it going to get better. So at this point, this is a yellow zone type of answer choice, okay? So our green zone answer question, or answer choice, sorry, is going to be D. Okay? All right, so let's do one more here. So question 3. The nurse is caring for a client who has returned from the post-anesthesia care unit, so PACU, after a prostatectomy. The client has a 3-way indwelling urinary catheter with an infusion of continuous bladder irrigation, or CBI. Which color description of the urinary drainage would lead the nurse to determine that the flow rate is adequate? So here we do not have a prioritization question, right? We have a clinical judgment question at this point because the patient has just returned post-operatively from the PACU unit. There is a CBI that's infusing, and we want to determine if the flow rate is adequate. So our answer choices are A, dark cherry, B, clear as water, C, pale yellow or slightly pink, D, concentrated yellow with small clots. So we're being asked really to evaluate the outcome of the CBI, right? We're not being asked to intervene. So we're hunting for what is normal or expected for someone who is post-op urological patient, okay? So we're looking for, again, green zone answer choices because this is a green zone question, okay? So let's start from the bottom up. So we have concentrated yellow with small clots. So, clots are usually not a good sign, right? Clot usually signals potential obstruction, and concentrated color could mean that the irrigation is too slow. So this here is a yellow zone answer choice because it could escalate to obstruction. So this usually is not what we want to see. Then you have answer C, where we have pale yellow or slightly pink. So this is exactly what we expect to see post-operatively with a CBI patient, right? Or a continuous bladder irrigation patient. It means that the flow rate is working and we're flushing without causing any trauma or under irrigation. So a little pink is normal post-operatively and indicates that the irrigation is working without causing trauma or clot formation. So here, this is our green zone answer choice. Okay? Then we have B, which is clear as water. So while this sounds clean and safe, it's not ideal, right? But in this context, it can actually mean that the irrigation may be running too fast and it's diluting the urine. So there is that risk of over irrigation and bladder distension. So it's not dangerous, but not correct either. So we will need to watch this closely. So therefore, I'm going to make this a yellow zone answer choice. Okay? And then we have the dark cherry, right? This is way too dark. It could indicate active bleeding, hematuria, or clots, which would require urgent flushing or intervention. So this is not normal for a patient just returning from the PACU. So we don't want to see this, right? It requires for us to intervene, therefore making this a red zone answer choice, okay? So C is our green zone answer choice, and the question is the green zone. So the correct answer here is C, okay? We want to see pale yellow or slightly pink urine output or drainage. So I hope those questions helped you understand or at least to see the types of green zone questions or stems that could possibly be asked on the NCLEX and how to determine whether or not the answer choice is a green zone, yellow zone, or red zone. Now, mistakes happen when stable patients are over prioritized or if we are unsure of delegation rules or we forget that chronic does not mean critical, right? So these are some of the things that we need to keep in mind. Now, once you have mastered identifying green zone questions and answer choices, this will help you move faster through questions and avoid second guessing yourself. If it's stable, it's predictable, and doesn't need RN level of care, then delegate it or delay it. This is what makes it a green zone answer or question. Congratulations, everyone, on completing the Traffic Triage Map Series. So right now for download, you can have the red zone, yellow zone, and green zone checklists where it will include additional cues, some examples, and tips for your review. And you can now start using this strategy with confidence on every NCLEX question. So I wish you all the best. I do have some more great things coming up for you, but I'm going to say bye for now.